So I always like to start with what is AI, and I'm sorry if some of you in the audience already have a lot of experience in this, because it's very important to take away the mystery out of it. And I always try to make it simple to understand. What AI is, at least from my opinion, it's us moving away from that clockwork universe. So I often use the example of fraud because I'm often talking to a financial audience. But in this example here, it's actually what we do on a day-to-day basis with our healthcare. We have some symptoms, headache, backache, pains, and we go to a doctor and say, "Hey, I have these symptoms." And what the doctor essentially doing is, very internally, he's looking at all the symptoms, asking you questions, knocking off some main observations, and from that information, they more often lead into either a very clear diagnosis, "Oh, you just have this," or they then request further investigation, which often takes place of scans. So that's basically a rule-based system that says, "Give me information, and I'll give you the next step." And what machine learning and AI allows you to do is move into that indeterminism. And what this is, in a nutshell, is the ability to harness a substantial amount of data over millions of verticals and being able to then come up with very deep estimations of what's going on. At least in the healthcare profession, as I said, a good example is medical imagery, and I'll talk more about that, how that's done. But you can imagine very complicated cases to diagnose. It can be very difficult, and it could take, days and weeks of scans and research to come up with the understanding of the ailment. But a machine can do that incredibly fast if it's able to access that kind of information. And so that's kind of where things are heading. And that's the power of AI. And this can happen incredibly fast and very incredibly easily. Of course, just to add another point of that sort of indeterminism, particularly when you're dealing with a doctor, that's kind of particularly if they give you a diagnosis and it may not make sense to you. That culture of being able to, "Oh, let me get a second opinion." I mean, that again is how things are done when you're dealing with a human being. That's prone to error, prone to misinterpretation. But of course, that's less likely with machine, with the amount of data you can see. And of course, again, that leads into quicker diagnosis and treatment. So this is basically what it is in a nutshell: is the ability to collect data, to learn from that data, to apply that data, to get some feedback, and then they continue. And that complete iteration of learning and applying and getting feedback is really why machines are very powerful, particularly if it's able to harness a massive amount of data. So when I just want to also hit the message home, when people talk about machine learning, when people talk about AI, they're essentially the same thing. So machine learning is a facet of AI. And within machine learning, there's a facet of machine learning called deep learning. And essentially, that is the most sophisticated level of AI capabilities we have right now. And deep learning, in a nutshell, is what we've done to almost replicate how the human brain works, our neural networks. Being able to, in a nutshell, how we operate is that we have neurons and neurons in our brains, and billions of neurons firing. And what they're basically doing is each neuron holds information and then passes it on to the next neuron, and that holds information passes on. So you can imagine our brains have massive networks of neurons. And so as human beings, we're able to compute very complex calculations because we have a lot of processing units. As each neuron essentially is a processing unit, passing on information to more and more processing units, which means we have a very advanced ability to infer and understand and perceive. So essentially the same thing with neural networks for machines. We create these neurons, artificial neurons, that are processing information and passing on to subsequent neurons. And as machines have become extensively powerful, so the ability to process billions of neurons very, very quickly is available now, which means that we can create very, very vast and deep networks. So now we can make machines incredibly clever. And sort of that's kind of where that big leap in innovation happened with AI. So I'll jump straight into sort of medical imaging, as I mentioned before. I mean, that in my mind was sort of the early stages, and still, I would probably argue that there's still a lot of innovation or space for innovation in AI. Thing about medical professions that you're dealing with people's lives, so it becomes very difficult to outright trust a machine. So there is still a lot of gaps and an opportunity that haven't been fully explored. But of course, particularly in areas where there's very limited choices, having a machine at least provide a semi-automated or a sort of guide towards a diagnosis can still be very substantially beneficial to people and help improve lives. What a lot of you must be seeing the great innovation around generative AI. And for me, I think this has provided a lot of very interesting opportunities in healthcare. So generative AI, for those of you who don't know, is the ability for machines now to take and it's all about data, a massive amount of data, unstructured especially. So it can be images, it can be documents, it can be videos, and ingest all that information. And with that ingestion, be able to generate new content. So you can tell the machine to pretty much draw almost any scenario. Tell me to ask the machine many different types of questions. You can ask it to design essays, write code, but it can do this because it has seen a multitude of examples and knows exactly how to give you the perfect answer. So we are now able to generate these LLMs, large language models, which means that we are able to have very deep and extensive conversations with machines and for it to generate very meaningful and very precise answers. And what we're now seeing is a plethora of healthcare specific LLMs that's now given the healthcare industry a lot of opportunities to provide automated services with machines. Now, you know, there's an extensive list of ways that generative AI can be applied to healthcare. I mean, the more obvious ones are the ones that I'm going to share now, and one obvious one is drug discovery. So being able to collect a lot of data about different techniques, different people's DNA, many different types of symptoms, problems, areas, and be able to use existing medication and adapting that to solve very unique problems. I mean, we all just came out of that horrific period of COVID. And imagine if there's another pandemic. Our ability now to quickly turn over vaccines, our ability now to quickly turn over medication to preserve life is becoming more and more prevalent. So therefore, we're better equipped to handling what's to come. And that's really empowered by AI and machine learning. And particularly in our market, my market in Africa, where I think there's a great opportunity, and I'm pretty confident over the next couple of years to come, we are going to see more and more innovation in the space, is having this personalized medical chatbot. Basically, being able to, in a very cheap and affordable way, pass on information about yourself and have the machine give you advice on any problems or symptoms that you might have. Now, what can really make this special, especially if the sooner the innovation comes, is that it can also perceive history. So it knows my medical history, it knows my my family medical history, and it can even more precisely give me advice and guidance on any experience that I'm having. And of course, then lead into very customized care. And again, all very possible without having a big, massive hospital, all very possible without having a super medical profession down the corner, all very possible just from something simple as a mobile phone device. Yeah. So it's very exciting to see sort of where this is going and the opportunities that come, because what you'll find is that as we are better able to trust machines, especially within the healthcare industry, we will see a reduction of human error. We'll see a reduction of we'll see the ability to provide healthcare 24/7, so you can be any time of the day, any day of the week, being able to get advice on your healthcare. And in fact, if we're even able to collect very long-term history, provide very guided and very specific advice on how to remain healthy. Yeah, looking at your body mass index, looking at your family tree, looking at your history of diagnosis and illnesses within your lineage, being able to provide you very tailored advice on how do you remain healthy and how do you live longer. So that's sort of the really exciting things that is coming. Now, I mean, I hate to advertise, but I just thought I'd take the opportunity to let you know that anyone in the community that wants to talk about AI and how it can be applied to your sector or to your specific problem, more than happy to discuss. At the core competency of Izifin is AI and machine learning, and of course, particularly in our market, we often look for opportunities in very niche areas and very niche problems to solve that can have a massive impact. So, feel free to reach out if you're a healthcare professional and you do believe that AI and machine learning is an area that you want to explore and expand in, and more than happy to get the team and I to have a conversation. Thanks very much.